ever since the World Health Assembly adopted a resolution for the worldwide eradication of polio in 1988, marking the launch of the Global Polio Eradication Initiative, there has been a drastic reduction in wild polioviruses. But there is still a risk of an international spread of this virus, especially with more cases coming up in some African countries. This disease, which largely affects children under 5 years of age, is usually transmitted from person to person through the stool of an infected person or droplets from a sneeze or cough. Countries who have close social-cultural economic ties to endemic areas or those with low immunization levels unfortunately stand the highest risk of getting infected. Joining us in the studio is Chairman, Rotary Family Health Days, Rotary Club of Ojodu, Dr. Ime Okon. Good morning. Thank you for joining us on TVC Breakfast. Now, at some point, we were excited that any issue with regards to polio, be it wild poliovirus, was a thing of the past, but now conversations are beginning to emerge with regards to addressing it, because it is said that polio anyway is a threat to children everywhere, and that's the message of WHO.
Yeah. So when you have a disease entity anywhere, it is a threat everywhere, just like you've said. In the case of polio, it is not different, because there's something we call herd immunity. And there is something we have international travel, so there is always that risk of the disease moving from one place to the other. A case I can quickly remember now is the case of, I think it was during the World Cup, sometime 2014 in Brazil, that there was a case that was discovered. Of course, Brazil had been declared polio-free, but that time there was a case that was discovered, and they traced it back to Equatorial Guinea. You can imagine. Yeah, and recently we heard of Malawi, Mozambique, and these are places that had otherwise been declared polio-free. Now we have two countries. I remember, I think it's 2002, they call them PAIN, the only countries that were left that were endemic. It was Pakistan, Afghanistan, India, and Nigeria. So from PAIN, we moved to PAN. India left. Now we have only P and A, Pakistan and Afghanistan. But the risk is still there because people are moving from one place to the other. There's something we call herd immunity. That is when you have immunity of the community. For polio, you need to have a coverage, vaccination coverage of like 80 to 85%, so that you can now be comfortable that even if the infection comes in, there won't be an outbreak. But if you don't have that coverage, and that's why we keep vaccinating and vaccinating, so that if by any chance, even though we've been certified polio-free, if by any chance any polio virus enters, we'll know that we are definitely covered. So until we get there, that risk is still there.
What is the issue with Nigeria now? I think it is now only PA, personal assistant. Which one is? I think it was PAN before, but there's no more PAN.
No PAN.
No PAN anymore. So why are we here?
So that is what I just explained, because since we still have two countries that still have that, we're still at risk. And that's why we keep vaccinating at every opportunity that we have. There's no overdose of polio vaccination. There's no risk. And since we know that this is a disease that has no cure, but it's 100% preventable by vaccination, and the vaccinations are free, safe, and effective. So just keep vaccinating.
What demographic should worry about it?
Like now that places that you have poor sanitation, then now I'm even worried now that we are having floods. So those areas that are prone, because this is a fecal-oral route of transmission, and contaminated water is a source. So those areas are flood-prone. You have rivers, dirty water, and things like that. That is the places that we're worried about.
It means that after the flood recedes, we are going to have a massive vaccination drive.
Definitely. They're working towards that. It's just that now that the floods are ongoing, of course, those places are not accessible. So it's difficult to do that. But I don't know. Recently, I saw Federal Medical Center, one hospital in Yenagoa that was totally submerged. So how do you reach the people in those places? It's actually a cause for concern.
Now, there was recently a $2.6 billion commitment by global leaders as a way of eradicating the virus and looking at 2022 to 2026 strategy to address that. How do you see this working out? What are the plans involved to addressing this, but especially in countries like Afghanistan and Pakistan, and if the 2026 goal can be achieved?
We'll work, it will be worked towards what the strategies that are usually in place. You know, we have the routine immunization, then we have national immunization days, particular days that the whole country will have mass vaccination in all the states that are involved. Then we have the supplementary ones that come even in between the immunization days. There's something we call routine surveillance. So surveillance is an ongoing, you keep checking if you have, like acute flaccid paralysis is what we use as a measure to check if there is the poliovirus. They check stools of people below 15 years. Acute flaccid paralysis is defined as when you see somebody that is below 15 years of age that has been walking. That person must have been walking before, then suddenly has a paralysis and cannot walk. You need to find out what is causing the most common cause is the poliovirus. So they take stool specimens. If you see anybody that has that kind of paralysis, you take stool specimens and check to know if it is poliovirus. So this has to be done actively, routinely, ongoing, so that we'll keep checking. Apart from vaccinating, we keep checking if that is in existence, and also environmental sampling. So the funds are committed into this. And you know, when you have the vaccines, apart from having the vaccines, you need to have the workforce that will drive this. You need to, because they go to even difficult terrains. Some people enter rivers, boats to go to difficult places. And even in war-torn areas, there's, I've forgotten the strategy that they used to call, I think it was, they called it hit and run. Because like in the Northeast, at some point when there were threats, serious threats like that, when you want to do the vaccination, just take your staff, quickly get there, vaccinate quickly, and you leave. Yes, definitely. So in Afghanistan and Pakistan, they are not free of that. They still have those war-torn areas. So such strategies can be employed. And of course, this is, I should say, capital intensive. So the funds will be directed towards that.
There are some superstitions related to polio in this country. Can we address those?
Like fertility, number one. No, it's just a myth. There's nothing in the polio vaccination that affects fertility, not in the male, not in the female. Some people talk about overdosage, like I've mentioned. That is wrong too. They said it has side effects. We have not been able to, we have not recorded any side effects that is ontowards, that is so severe. The only thing, okay, maybe vomiting, mild, maybe fever, and it's very rare. It's a very safe vaccine, polio vaccine.
You talked about flood and flooding and so on. What exactly should people watch out, or what should organizations like yours or the health policy makers, focus on as the floods continue to intensify as regards this very matter of polio?
Okay, so there are still, even though flood is ongoing, there are still some areas, like in Bayelsa now, there are still some areas that are dry. I know people like organizations like Nigerian Medical Association have been working with partners to carry out outreaches. So they find a way of getting across to the victim of floods. We have IDPs, so they try to get medical services to them. So in such situations, you can still try to get the medical services, including vaccinations, to those people. When you get a dry area, when you move them, when they are displaced, they are in the IDPs, that's the only place that is dry that you can reach them. So you try as much as possible to see that these medical services get to them.
Some people think that polio is a death sentence, but it's not. I have a friend, very good friend of mine, who has a normal life.
Is a survivor.
A survivor. And we all know of the most famous polio case in history, the former president of the United States, Frederick Delano Roosevelt, who shepherded the Allies through the Second World War on a wheelchair, you know, which is significant. Tell us about surviving and thriving, even in spite of polio.
Yeah, so we have survivors. We have them, just like you have mentioned, even in the medical profession. So a lot of psychotherapy, physiotherapy, and ways we can assist them, because sometimes, you know, we fight stigmatism, stigmatization of these people. We shouldn't be doing that, because it's not as if because they have that polio, by shaking them or working with them, you can get it. So we try to accommodate them as much as possible. And our society, well, are we in this part of the world so disability friendly? That's another thing. So we try and get our environment so that they'll be able to adopt or adapt easily into the, we have them. And it depends on the severity of the disability. Some of them is just maybe one limb that is affected, one leg. So they have their ways of coping.
Okay. I would like for us perhaps to talk about the severity, how the various levels of severity to this aspect of polio, for people to understand, and, you know, just by educating people.
Okay, so the severity is just according to the area that is affected by the paralysis. So you could have one limb, you could have more than one. So when you have one limb, you see some people working with crutches. Then if it's affecting the two limbs, then they use the wheelchair and all that. But we know that this nervous system affectation, sometimes it even gets to the respiratory system, and that is the one that can cause death. So that is the extreme one of it.
If it was not really quickly addressed.
Addressed, yes. That is it, but it's not that common, maybe like 1% of the, and it is said that out of 200 infected, it's just about 1 out of 200 children that are infected by poliovirus that actually have the paralysis.
Do you have any sense of those areas in Nigeria where we had them, especially places like Kano and so on? Are there checks or monitoring systems to be sure that certain standards of hygiene and medical infrastructure are in place to ensure that there is no recurrence?
In fact, a lot of funding is committed towards surveillance and having more vaccination routine and supplementary days over there in the north. At some point, the southern people were even getting like jealous. That's why is there so much funding and focus in the northern part. They even go to the extent of giving things we call pluses. Anything you do that encourages people to accept your vaccination are called pluses. So you see sometimes they give sweets, they give detergents to mothers, they give Indomie, they give things like that just to support and encourage the vaccination. So when it comes to the hygiene too, yes, they support with all those things. Then the surveillance that I mentioned is intensified in those places. This is active surveillance. You don't just wait for people to come and ask, tell you that they've noticed that somebody has suddenly developed a paralysis that fits into that definition of below 15 years, somebody that had been previously working. You go out, the health workers actually go out to search for some such cases.
Which areas across the country are most affected by polio from your work in the field?
Okay, I've worked in places like Kano, like you mentioned, Kaduna, then Borno. Those places, those are the ones I can quickly
How about
pick on.
towards the south and the southeast and southwest?
It's not that common. I can't really place the figure on recent happenings polio in the South.
Oh, all right, all right.
Well, are there some things that people need to know as far as diet is concerned? Is there any dietary recommendations that can help you fortify the body against any onset of polio? And secondly, how does polio play with underlying illnesses?
Okay, so it is a disease that thrives with reduced immunity. So when you eat well, balanced diets, eat vitamins and proteins that can help your body to fight and improve your immunity, those are the ones that are highly encouraged, not just taking so much of carbohydrates without fortifying it with enough vitamins and proteins. Then, what was the last thing you said?
In the underlying
The underlying illnesses, yes. So regular medical checks assist with that, because if you have underlying illnesses like diabetes mellitus that suppresses immunity, of course we know HIV, TB, those are very common that suppresses immunity. It increases the chances of somebody, because it's possible for you to be infected, however you're not coming down with the disease itself. So the immune system can always fight it if you do not have immunosuppression.
So at this point, what's the level of Nigeria's commitment to ensure that we do not see a resurgence of the poliovirus?
So like I mentioned, those our strategies are in place and they are top-notch. The routine immunization that we have, and we have the national immunization days, and it's up. Then we have outbreak responses. Once there's something we call vaccine-derived poliovirus that is seen in the environmental surveillance. So once it's detected anywhere, all the areas that are close to where it has been detected, you just have to massively vaccinate the children in that area.
All right.
I spoke about...
we have to wrap up now. Yes,
right.
yes. I'm being told we need to quickly wrap up this conversation now.
All right.
But we must thank you, Dr. Emil Kohn, Chairman, Rotary Family Health Days, Rotary Club of Ojodu, for your time.
Thank you very much. Have a nice day.
You too.